Hello, everyone. It's May the 7th, Thursday, and this is our briefing. We were really on a nice little streak. We hadn't lost anyone since Saturday, but that ended yesterday evening. We lost another great West Virginian yesterday evening, a 83-year-old female from Berkeley County. It's our 51st death. I've said it so many times, and I don't really care if you get tired of hearing me say this, but it's 51 too many, and we should all feel exactly that way. We've got to keep all these people in our thoughts and our prayers. Over and over, I say that these people have names and their families, and they're great West Virginians, and we, I just wish to goodness that we could just eradicate this killer pandemic and it would have never come, but West Virginia was doing lots and lots and lots of great stuff, but in this whole thing we have shown our greatness beyond belief as well. I mean, just the simple fact that you continued to respond in every way, and we have kept the numbers spectacularly low and everything. We hate that the numbers are one death, but at the same time, if we look at all of our neighbors and we look at our nation and we look at what's happened everywhere, we've lost in excess of 71 or 72,000 now. 72,000 Americans. It's a crying shame. I share in President Trump's sentiments, that a lot of this could have been stopped, if we would have been given access into China and giving access to data and everything. So much of it could have been stopped. It's a shame. It's just a shame. And so nevertheless, we continue to go forward. This is a extremely, extremely special day. I've told you many, many times, I'm very, very proud that I tell everyone I'm a Christian, and I am very proud of it. I don't hide it. And today is our National Day of Prayer. And so if there's any day on the planet that we all need to gather and say prayers and try to ask the good Lord above to intervene, and He's in control, and He's watching after us, and He's especially watched after West Virginia. And so we just got to continue to ask and send up our prayers, and so what an incredible, incredible day. So please join Kathy and I in your prayers, and thank you so much for them. I guess the number one thing that I need to announce today is this: we became the first state, and this is great stuff to me, because when you become the first state versus West Virginia, that was just kind of forevermore just maybe looked on in the wrong way, and looked on in a way that people pitched us as 50th too much. But all of a sudden, when you're the state that is leading the way, it's good stuff. We led the way being proactive by leading the way. We've produced these incredible numbers. And you notice that I always say we, because the we is the whole bottom line to everything. Just because Jim, your governor, would want something, or your health experts would tell you something, if you don't do them, West Virginia, we lose. If you do them, we win. And that's all there is to it. And so as we, as West Virginians, were really proactive and did and pushed the right buttons and moved in the right direction and moved decisively and moved fast and everything, we have traversed across the landscape, and the numbers have been really, really good. Then all of a sudden we had issues within our nursing homes, and we even had discrepancies that I was unhappy with from the standpoint of the numbers and the inconsistency, and all of a sudden, just in a matter of no time. And that's the one thing that I've learned through all the business work that I've done. Opportunity doesn't stand there and look at you forever. You can't study stuff to death. You can't have 15 committees. Somebody's got to make a decision. And we made the decision right then to test all the nursing homes. It was a good decision. The first state in the nation again. First state in the nation. Now, today, by an executive order that I signed yesterday, we are now the first state in the nation again to test all the assisted living facilities. I love it when I'm able to report to you over and over that West Virginia is the first. And so we are setting a national example. People are paying attention to West Virginia, and the fruits will be numerous as we go forward. And what I'm saying is just this. Just think if you're in a New York or wherever it may be, and you've got a manufacturing facility, or you're in the medical field or whatever it may be, and you're, and there's a need to create facilities across this country to make product and whatever like that, and you're living on top of one another in a situation that is totally out of control, and you're watching this little state in West Virginia that's within a rock's throw of everybody, and absolutely on the move in every way possible, and you say, dag, that's where I want to be. And at the end of all this, that's what we want. We want any and every business opportunity, job opportunity to come right to us and let them learn just how great you really are. And so as far as other announcements that I've got today, we will have the date and the guidelines for the Hatfield and McCoy Trail, and we will announce that tomorrow about the Hatfield and McCoy Trails reopening. That will be coming down the pike in a relatively short term, and so I'm really happy that we're going to have our homework done, and we're going to be able to announce some good stuff in regard to the Hatfield and McCoy systems. Of course, about week 2, about week 3. The only other things that I have here are the Scott Atkins, the Director of Workforce, is with us today, and he'll provide you an update. And the only other thing that I've got is just this. I always share with you naturally the news. Some people think that at times I'm only sharing with you the good news. That's ridiculous. I want us to be completely transparent in every way possible. From our charts, the positive growth rate yesterday jumped up to 3.1% and everything. That's not the end of the earth and everything, but it did jump a little bit. Our cumulative is still great at 2.24. As far as the active cases versus the recovered, those trend lines are still working exactly the way we want them to work. We've got 716 that have recovered and 476 that we're looking after that are active cases. And so all that's trending and working well. Now, before I pass this off, I want to remind you again to help me with the census. And if we could put that frame up just a second, if you could please tell anybody and everybody you know to make sure you get counted. That's really, really important. And I guess, really, I'll stop there and I'll end it up in just a few minutes. Thank you.
All right, thank you, Governor. Now let's go to Scott Atkins, the Director of Workforce West Virginia.
Good afternoon. Thanks, Jordan. Workforce staff have processed for payment more than 164,000 unemployment claims since March 16th. That equals about $151 million in regular state unemployment benefits and more than $225 million in the extra 600 payments since the COVID-19 hit West Virginia in mid-March. Starting yesterday, Workforce is accepting applications for the extra 13 weeks of benefits provided by the CARES Act. A lot of folks have been asking about that. Yesterday was the first day. So if you've exhausted your regular unemployment benefits after July 1st of 2019 and you are currently not eligible for any state or federal unemployment benefits, you may be eligible for the extra 13 weeks. If you're currently on unemployment or you have an open unemployment claim, you don't need to do anything at all except continue to file your weekly certifications. If you find yourself in that July 1st of 2019 time frame to apply for the extra 13 weeks, you can go to workforcewv.org. In the middle of the web page, there's a green banner. Just click that green banner. It's a brief 8-question application. Your weekly benefit amount will be based on what your previous unemployment compensation claim was, plus the extra $600. Eligible individuals will be paid the same method as they chose on the regular unemployment. So if you were receiving your benefits on a debit card, you also receive these benefits on a debit card. If you're receiving your benefits on direct deposit, you'll get those on direct deposit as well. For folks who filed over the last couple of days for the 13 weeks, by midweek next week, you should start to see those payments. If for some reason you were determined ineligible for the 13 weeks, we encourage folks to go ahead and file that application for PUA. PUA, just an update on PUA, for those folks who are independent contractors or self-employed who filed those applications starting 2 weeks ago, those funds will hit the bank this weekend, and folks should start to see those dollar amounts in their either checking account or their key bank card that they received in the mail. The minimum PUA payment in West Virginia is $158. And so folks know that $158 is 50% of the average weekly benefit amount during the first quarter of 2020. That amount is determined by the federal government and it varies from state to state. So what that means is that every eligible PUA claimant in West Virginia will receive the minimum payment of $158 plus the $600. In other words, each PUA eligible week provides $758 in unemployment benefits. The first PUA benefit payment that you'll receive next week will include all the eligible weeks. So for example, if you filed an eligible PUA application 3 weeks ago, your first payment would be 3 weeks at $158 a week or $474 plus the 3 weeks of the extra $600 for a total of $2,274. Workforce is currently in the process of reviewing all the income documentation that was either uploaded on the PUA application or has since been mailed or faxed. Once those income documents are reviewed and vetted, then eligible PUA applicants' weekly benefits amount may be adjusted as necessary. And if you're owed money from Workforce because your average weekly benefit was more than the minimum payment, then Workforce will make sure that you get those full benefits. For folks who are asking questions about doing weekly certifications for PUA, you don't need to do any weekly certification until starting Monday, May the 10th. And you'll do those weekly certifications for this week. And you can do that by going to the PUA site at workforcewv.org, log in, complete the weekly certification, and then you'll be good to go for the following weeks. Thanks.
All right, thank you, Scott.
So before we go any further, I've got to say this in support of Workforce West Virginia and in support of Scott and the jobs that they're doing. I've said it over and over and over. I have total sympathy. We don't want one person waiting. We don't want one person to not be served. I mean, that's all there is to it. But last night, I was watching TV like I always do and going through the channels, the news channels and so on like that. They showed a picture in the Bronx in New York where people were standing a half a mile around the building. They said the line was a half a mile long. And so absolutely, it may not have been perfect and the times may have been really tough because we were trying to jam stuff in a bottle that was awfully small and we were trying to jam 10 things into a one thing bottle. But really, Scott Atkins, and all the people that have jumped in from the Guard and everything. They've done an amazing job, and they're going to continue to do that, and we're going to try to do exactly what I just said, get every single person served. And so, but be proud of them. They've done a lot of good work.
All right, thank you, Scott, and thank you, Governor. Next, let's go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Just a couple things to highlight today. Yesterday and throughout the week, West Virginia National Guard will be working with Division of Highways to train personnel in personal protective equipment and other sanitization techniques as we begin to start to work to bring more of our West Virginia workers back into operation. Just want to highlight a couple things on behalf of the National Guard. We passed today 870 missions that have been conducted in the past 55 days by over 700 guardsmen. So on behalf of Governor and myself, we just want to thank all those guardsmen who worked so hard over the last number of days working with our other state partners who are doing such great work, as the Governor just pointed out. Last thing I'd like to leave you with today is volunteer organizations active in disaster, or VOAD, Catholic Charities, and the Council of Churches have started a food drive in the month of May. If you could, please look at donating. And you can go either to the VOAD site that's listed here or call 211 and get the location of your nearest food pantry and help us donate to that. As we pointed out many times, and the Governor's pointed out, some tremendous work has been done by our food pantries and our volunteer organizations as we help to make sure all West Virginians are taken care of during this pandemic. Thank you.
All right, thank you, General. Next, let's go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. I don't have as much to report as sometimes I do, which is probably a godsend to many who are watching. As we look at some of the numbers the Governor has gone over, the good news that we continue to experience, but to me, we also need to pay attention to some of perhaps lagging statistics. Our R0 value was 0.9 yesterday, is 0.89 today. One of the places that I'm keeping a close eye on is Georgia, that has opened aggressively. Their R0 value has gone up to 0.86, and over the last week, Georgia has experienced 231 reported deaths, which is a quarter of all the deaths that they have had up to this point. So as we follow the numbers and continue to try to open very safely and do it step by step as the Governor has outlined, we'll be watching those a little bit ahead of us, and also be watching some of the numbers that may lag the current statistics. Remember that things that happen today won't fully be realized in West Virginia or in Georgia or in any other state or country for around 10 days to 2 weeks. And things that are going on 10 days and 2 weeks from now, even if you start to reduce everything, won't go away, even if you do all the right things for about the same period of time. The only other comment I want to have is that Singapore, which was the country that really was lauded as doing everything right, now actually has the most cases on the second round of any country in Asia. They had outbreak that was really started by people who were expatriates that were brought into the country to do the labor for the country. And so it just is a warning for us and a reminder that as we go forward, we want to make sure that we are watching very carefully and assessing step by step. And as the Governor said, the goal is to open up the economy, and as the President has said too, to get people back to work and really help America, yet at the same time do that safely. So thank you so much.
All right, thank you, Dr. Marsh. Also from the West Virginia DHHR, we have Secretary Bill Crouch and Dr. Kathy Slimp, and from the West Virginia Department of Military Affairs and Public Safety, Secretary Jeff Sandy. They're both joining us today and available for questions. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Governor, forgive me because I have a governing philosophy question. You've had to make a lot of big decisions during this extraordinary health crisis, shutting things down gradually, a stay-home order, now loosening up those restrictions. And what I wonder is if you can describe the standards that need to be used, these steps of the way, as you make these extraordinary decisions to use the governor's emergency powers.
Well, Brad, the first standard with me, at least, is a lot of prayer. And I mean that very sincerely, because you're dealing with, not only you're dealing with life, you're dealing with an economic potential catastrophe as well. You know, whether it just be that an individual can't pay his bills or her bills, you know, or it be, God forbid, something that would be way beyond that, you know, an all-out depression that would pit neighbor against neighbor, or there would be food shortages like crazy, or whatever it may be, you know. And so the decisions are really tough. You know, I've relied first and foremost on the good Lord, an awful lot on my family, awful lot on the experts that I've surrounded myself with, because they are second to none. But beyond that scope, you know, I talk to the world, and I do my job from the standpoint of what I've done for a long time. I've had a lot of experience dealing with tough stuff. And that's why I said right off the get-go that I am honored to be in this chair and to be making these decisions, because I'll make them as best I possibly can, but I do believe the good Lord put me here to be in this position, and I absolutely am not going to run from it. Now, as you accumulate all that information, you've always got then to back up and look and question every single part of the decision-making process. And I've said it many times. If you were to ask Jim Justice what he thinks his best virtue is, I'd really surprise you. Because if I were to ask you just that, Brad, you know, what do I think is the best trait that I have? Would it be my ability to communicate with others, or all my business experience, or would it be all those things? And it wouldn't. It would be one thing, and that is the ability to doubt myself. The ability to always look for a better answer. The ability to go out all the time and just say, am I missing something? Am I missing something here? And that's what I do. And I pound the sand in every direction, whether it be the gurus at Johns Hopkins, or whether it be the President of the United States, or whether it be our great experts that we have, or the prayers to God above. And then we make the best decisions in a situation of a pandemic that nobody has ever had the answer to, nobody's ever seen before. And we make the best answers that we can, or answers that we can possibly come up with for this state.
All right, thank you, Brad. Next, we'll go to Kenny Bass with WCHS.
Hi, this is Kenny Bass with Channel 8 and Fox 11. I have a question for the governor about the assisted living homes. I spoke with a manager at one of the large homes in the Charleston area today, and they're uncertain as to what all employees mean to be tested. Some kitchen employees who don't have direct contact with residents, they don't know if they're going to test them. And I'm wondering what you're feeling about that. I mean, when you say all employees, what do you mean? And how would you like those employees tested? Even if they don't have direct contact with residents, they're still in the kitchen. So what are your thoughts about that?
Well, Kenny, my thoughts are real simple. You know, I don't know how you describe all as not being all. That's all there is to it. It's just as simple as that. All's all. And so that's the way it's going to be with me. And we're going to try as best we can to flip every rock and to to test everybody. And you know, and there'll be rocks we don't flip and we mess up and whatever. I get it. But to me, all's all.
All right, thanks, Kenny. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here, and I kind of hate beating this dead horse, but I think it's important just to get some further answers from this. So if Jeff Sandy can answer this question. But the one thing I'm kind of confused about in regards to the mask issue is I know that you put out a memo to first responders on April 16th, going through your investigation and determining that the masks were legit, if at least, you know, not the NIOSH approved masks, but they weren't counterfeit. My question is, when did we specifically know that the masks, some of the masks, you said 50,000 yesterday, were the wrong type of masks? Did we know this when we originally got the shipment? Did we know this before we sent them to first responders? And did first responders, were they aware of that prior to the April 16th memo that came out? Thank you.
Stephen, I'm going to have to pass that to Secretary Sandy or someone other than me, because I was not privy to that information.
I will take that. The masks were ordered on March 19th. They started coming in on the 23rd. We distributed those on the 23rd. The masks are in a sealed plastic for sanitary purposes, and they come in packs of 20, and we ship those out to all the counties per what the emergency managers wanted. Then the demand was for more, and on around April 1st, another 20,000 went out to the state emergency managers. We first became aware of the issue when a fire chief contacted Homeland Security and stated that he had seen this on the CDC website. And on the 10th, we started the investigation. But your question is, did we notify them? We notified the Emergency Managers Association that this had come up. And in fact, we had supplied them with what the fire chief had said. So the state emergency manager should have known on or about April the 10th.
All right, thank you, Steve. Next, we'll go to Todd Boucher with WTAP.
Good afternoon. We had some information on the air from the DHHR website earlier this week that said that 2 workers at, and I have this down as a skilled nursing center called the Parkersburg Care Center here, tested positive for the virus. Now, we heard from the company that runs that facility, and they tell us that these 2 employees had not worked at the center since February 5th. Now, were these people who tested positive in your test, were they at the time of the test, were they in fact employees there? And maybe as a follow-up to Kenny's question earlier, are you looking also to test employees at skilled nursing centers, since you've now done nursing homes and assisted livings?
Well, my answer is just this. We want to continue to expand our testing more and more and more as we can. Now, as far as those 2 individuals that you're speaking of and everything, maybe Secretary Crouch or Dr. Slimp, you know, can weigh in on that. I don't know the details of that.
I can speak a little to these things. I don't know the specifics of that one situation, but I can say that we do have several situations where we have individual isolated or 2, say, employees or an individual resident that it appears that there's really no further implications or spread from that. We're looking very closely at what those mean. So the gist of that is every time you have a positive, you do a rapid investigation to understand what's the risk and what's happening there. So if those individuals were not working in the facility, then you've eliminated that risk. We did test all employees, actually all staff. We did not limit it to simply official employees Same with the listed assisted living, all employees are residents of skilled nursing facilities across the state with the executive order for nursing homes under the governor's direction.
All right, thank you, Todd. Next, we'll go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. I wanted to ask what kind of criteria is being used to make the decision about what is opening up as the weeks move forward here? If you can give us any insight into the decision-making process.
Okay, maybe Clay, you can answer that. I didn't get any. I didn't get all of it, but I think, Amanda, if you said what is the criteria used as we're continuing to go forward and everything,
Yes, sir.
and what criteria are we going to use that enables us to open up more and more and more?
Correct.
Okay, well, the answer is just really simple. It's a collage primarily of info that is coming to us, whether it be numbers all across the state, all kinds of assessments from our experts. All those things are the primary drivers, and as we evaluate those, we are looking more and more and more about the possibilities of what else could be open safely. But at the same time, we're watching everything that's going on, as Dr. Marsh said, in Georgia or these or neighboring states that are doing this or that and everything else. We're trying to just feel our way through the wickets and make the right decisions. And so you got a lot of input coming from a lot of different directions. I will promise you wholeheartedly, this is not like that we're looking, and there's Leonardo that's sitting over in the corner that's coming up with, a statement and saying, open this on next Thursday. This is really detailed stuff.
All right, thank you, Amanda. Next, we'll go to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor. Dave Mistich, West Virginia Public Broadcasting. My question is about the federal funding that's come in. We received $1.25 billion. So far, you've said that you are hoping you're planning on holding that back to backfill the state budget. Of course, that hasn't come through. I'm looking at an analysis from the Associated Press that shows, as of Monday, we received what equates to more than $1 million per positive case. I'm curious what you plan on spending this federal funding on, and how you're directing state agencies to use this money, and specifically what it would be going to.
Well, it's impossible to answer that question, from the standpoint of all the different things, because we'd be here for hours in order to try to adequately answer the question. Again, just think about this on either every day or every other day, I'm meeting with all the revenue team and and getting briefed on every single aspect. Plus, I am talking myself to consulting agencies and everything, whether it be BDO or whomever it may be, and I'm getting updates from them as to opportunities and things that we may have. I'm basically trying to do just this. I'm trying to ensure that our state is backfilled lost dollars that we lost because of this terrible tragedy. I am trying to keep our state from taking a blow, a cannonball to the stomach that basically at the end of the day would reel this state into a very, very difficult position. And in doing so, in doing that, I am also at the same time trying to figure any and every way that we can source additional dollars that are available, Fed dollars that are additional, that we can bring into our state. Now, on top of that, then you've got the counties, the cities, and you've got every single aspect of the hospitals, the higher ed community. You've got so many different aspects here that you've got to look at and everything. And there's buckets of money that are coming in from those. Now, I think, and I've said it several times, the Senate's in session. The U.S. Senate's in session. The House is supposed to come in on Monday. I really believe we're going to know real live rules that we can act on a little bit prior to there, you know, and very much after that. And so the bottom line of the whole thing is just this. You have considerable dollars even beyond the $1.25 billion, which is an enormous amount of monies. You have considerable other buckets of dollars that are coming into West Virginia right now. You know, it's my goal that we substantially exceed $2 billion of dollars that come into West Virginia from the federal government that we can do stuff with. Now, what we've got to do is we've got to ensure first and foremost that the mothership stays stable. The mothership is the state. The state has got to stay stable before we branch off in a lot of different directions and sink the mothership, and then all the tentacles die. So that's just it. I mean, it's a balancing act, but I can tell you this, that you got a lot of really smart people working on this, and if anything in the world that really, truly, that I feel strongly is in my wheelhouse, it's the economics and the business part of it.
All right, thank you, Dave. Next, let's go to Paul Mullen with WCBC Radio.
Paul Mullen, WCBC. Good afternoon, Governor. Good afternoon, panel. My question deals with the federal prison issue. I understand that we got word today that Gilmer has 3 more positive cases. That takes them up to 4. And I also understand that no inmates have yet to arrive at Hazleton. That may or may not be true because my information is dated this morning. I also received word that there was a teleconference between West Virginia officials and federal officials concerning this. And Governor, I'd like you to address that. Do you know of that teleconference? Was it with federal officials, state officials, and where are we at there?
Well, let me say this, that I guess the easiest way is just cut right to the chase. I think if you were to consult with all of our congressmen and ladies, if you were to consult with our 2 senators, and surely if you were to consult with me and all the people in my shop right here, we have absolutely pushed as hard as we can push because we believe that it's not the right thing to have done. And we absolutely are continuing to push every way in the world. Now, as I understand that there's a letter that is back today from the prison, from a prison board or whatever, a director, but maybe I could let Brian Abraham come and maybe he could shed some insight on that. And Brian, do that, please, because I think it's terrible. I think it's absolutely terrible. And we have pushed in every direction and everything, and we've been told over and over, well, we can absolutely, give you the proper assurances that things are going to be okay and that these people, have been cleared and all that kind of stuff, and you see what's happened. You see exactly what's happened. We've got people that we brought in here that have the virus. But if we could pass to my general counsel, maybe he can give you some more information that I just couldn't give you.
As many people know, the governor wrote a letter last week to the director of the Bureau of Prisons and requested that those prisoners not be brought into West Virginia, particularly in Preston County. Shortly thereafter, we also discovered there was the 1 positive there at the Gilmer County facility. Director Carval of the U.S. Department of Justice Federal Bureau of Prisons responded to the governor's letter today, assuring us that they had greatly reduced the transport of their prison population, that they were taking every step to protect those inmates, that they had increased the testing, particularly at the Gilmer County facility, that they had the immediate test in place there and were continuing to test. and assured the governor that they would take every precaution to protect not only the inmates but the staff members there that were members of the public here in West Virginia. So we'll continue to work with them going forward. But they did take heed of the governor's request, and I think we are in a much better position today.
All right, thank you, Paul. Next, we'll go to Haley Kosick with Next Star Media.
Governor and everyone here. My question is a little bit tailored to the Charleston Town Center. We've had many businesses reach out to us asking what are the proper protocols, and we haven't heard back from their press department. So in an ideal world, what would the Charleston Town Center need to do to even be considered for reopening?
Okay, I think Secretary Crouch, maybe you can start this and I'll end it up.
Certainly. Thank you, Governor. Thank you for the question. Clearly, as we move forward, the governor says this is a balance. We must be very careful in terms of social distancing. We have to be careful in terms of sanitation stations and hygiene. All of the things that we've talked about for the last 2 or 3 months are still in place. In fact, are even more important than they have been. If you've noticed, other states have opened quickly, maybe too quickly, and have a lot of gatherings at malls that have not been beneficial in terms of containing this disease. So I think we're weeks away from that point. The governor has been very good. He has his finger on the pulse of this in terms of moving forward and how fast we should move forward. Dr. Marsh is giving us very specific scientific information that we look at daily, and we're watching that R0 number very closely. So as we move forward in opening things, we will provide guidance on how to do that. But I believe we're a little ways away from that at this point. We have some local businesses that are very interested in opening, and a lot of other folks. So we'll move deliberately and slowly and try to keep people safe. So again, everyone in the state is doing a good job. Keep that up. Continue to be safe and keep your family safe.
I think I could add to that from the specifics, all the same activities related to essential businesses and how they've been operating, and also the small businesses, the 10 and under operations, those all would apply to other businesses when it becomes time to open up. So we still have those same restrictions in terms of space, and we still have those same restrictions in terms of masks, and those same restrictions in terms of screening your employees, and all those precautions that you would do. So those same things would apply in opening up. People can use that for planning purposes.
Let me come back to me just one second, Jordan. I said I'd end this up, but I want to elaborate just 1 second on this and just say just this. We've been in discussion, with the town center people or town center people and the from the standpoint of talking, about formulating a plan, and those plans have to have best practices. They've got to have social distancing. We know all that. We know all that. But let me just say this. We all, as West Virginians, would like to have our whole life back to normal. That's what we'd like to have. But let me tell you, we've still got a killer in the neighborhood. We've got a killer right in our midst all the time. Until we get a drug that we can protect you, and that drug may only be 2 or 3 months away from the standpoint of turning this killer into a common cold. And then the vaccine hopefully will not be many months after that. But I am telling you just this. If we as West Virginians, if we turn our focus on, we'd like to have the mall open, and we'd like to have this open, we'd like to have this open, and we want to go back to doing exactly what we were doing yesterday, and then all of a sudden we're going to awaken to some stuff that is really tough stuff. Now, we're trying. Our experts are trying. All the good people are trying to give us a life as quickly as we possibly can while protecting us. But I don't want to be the one that says, let's all run back and run back and run back and run back, and then all of a sudden we've got a teetotal catastrophe on our hands. And then there's so many that will stand around and say, well, why did we do that? Well, we want to be smart. Remember what I said early on. I said, don't panic and be smart and be absolutely great West Virginians, and you've already done that. And that's what we're going to do here too.
All right, thank you, Haley. We have time for one more question. We'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, earlier today, members of the Senate Democratic Caucus had a press conference scheduled, but then they announced that they had canceled it or postponed it after your office had indicated a willingness to meet with them. Specifically, they wanted to talk about, kind of following up with what Dave asked about the CARES Act. Could you talk about when you expect to meet with them and what you hope to get out of that meeting?
Listen, Charles, I am so easy. I've said it over and over and over. I think we're leading the way from the standpoint of Republicans in doing good stuff. That's the party that I'm very privileged to be in. And I think we're leading the way in doing great stuff. But at the end of the day, from my standpoint, it doesn't matter if we're Republicans or Democrats. It doesn't matter if we're independents. It only matters one thing, and that is if we're West Virginians. West Virginians all pulling the rope together. I stand ready to meet any time. I don't care what the time is, what the hour of the day is. I want everybody to know what we're doing and to have their questions answered, their views respected, and absolutely, this is a bad thing that we're dealing with here. This is not politics. This is people's lives, and this is people's livelihood. So we're going to meet, and we're going to meet immediately. I don't know if that immediately is tomorrow or over the weekend or Monday or whenever it may be, but it will be immediate.
All right, thank you, Governor. I'll turn it back to you.
The only thing I have in closing is just this, is to just say, yesterday, evidently I appeared, maybe prior to yesterday, that I appeared to others that we were moving ahead, full steam ahead, and then maybe my tone yesterday was a little bit more concerned. And so there was questions that came up, well, what's wrong? What's come up? Well, nothing's come up. Nothing's come up except just this. We see that New Jersey had 400 and some deaths, boom. We see what's really happening out there in Georgia and different places. And we see that West Virginia, that we're trying as hard as we possibly can to move as close back to normal as we can move and protect us. And if you're me, and please be me just 1 second, when you're sitting at home, or you're driving up and down the road, or you're sitting over in the mansion, or wherever you may be, and you have a moment by yourself, and I said, what I think is the best characteristic I have is the ability to doubt myself. You're saying, are you sure? Are you sure really that you want to do this? Are you sure you don't want to go ahead and get more going? Because we know that people are hurting if we don't get more going. Or are you sure that you just want to pull the reins back just a little bit and be a little bit more cautious? It's tough stuff. It's really, really tough stuff. And so if my tone comes off one way or another, I try to be as transparent as we can possibly be. There's nothing that's come up that's different. There's nothing in any way, except just we really are trying to just be smarter and smarter that we can, as we can possibly be each and every day. Now, I'll close with just saying this. Remember that yesterday we honored heroes in our Nurses Appreciation Day and in our Interpreters Appreciation Day. And today is our National Day of Prayer. Please observe that. please let God know that we need him, and we need him really bad, each and every one of us. So thank you so much. Tomorrow we'll have guidelines and a date on the Hatfield and McCoy Trail, and we'll just keep moving north. That's the thing for us to do. Thank you so much.